Spinach represents an important teaching point in gout dietary guidance. Purine content alone does not determine food safety. This leafy green contains moderate purines that, by traditional logic, might suggest avoidance. However, comprehensive research demonstrates that plant-based purines behave differently in human metabolism compared to animal-derived purines, and the overall context of spinach consumption supports rather than undermines gout management. Large epidemiological studies tracking thousands of participants over decades have found no association between plant-based purine intake and gout risk. This finding holds even when analysis specifically examines higher purine vegetables like spinach, mushrooms, and legumes. In contrast, the same studies show strong positive associations between animal purine intake and gout incidence. The mechanisms explaining this plant versus animal purine distinction likely involve multiple factors. Plant foods contain fiber that may affect purine absorption or metabolism. The overall alkaline ash of vegetables may promote uric acid excretion. Plant foods' rich phytochemical content provides anti-inflammatory and antioxidant effects that counterbalance any minor uric acid elevation from purines. Folate content in spinach is exceptional, with 1 cup of cooked spinach providing approximately 60% of daily requirements. Folate supports DNA synthesis, cellular division, and red blood cell formation. For gout patients taking medications like methotrexate, occasionally used for refractory gout, adequate folate intake becomes particularly important as these medications can affect folate metabolism. Iron in spinach, while non-heme and less bioavailable than animal iron, still contributes meaningfully to intake when combined with vitamin C-rich foods. Spinach itself contains vitamin C, enhancing its own iron absorption. For individuals reducing red meat intake due to its high purine content, plant iron sources like spinach become more important. Magnesium in spinach supports the hundreds of enzymatic reactions this mineral enables, including those involved in glucose metabolism and insulin signaling. As discussed repeatedly, insulin sensitivity affects uric acid excretion, so magnesium's metabolic effects have indirect gout management benefits. Spinach provides concentrated magnesium in a low-calorie format. Antioxidants in spinach include vitamins C and E, beta-carotene, and various phytochemicals like lutein and zeaxanthin. These compounds work synergistically to neutralize free radicals and reduce oxidative stress. Chronic oxidative stress contributes to inflammation and tissue damage in gout, so foods rich in diverse antioxidants support overall disease management. Vitamin K in spinach is extremely concentrated, with a single cup of cooked spinach providing over 800% of daily requirements. This fat-soluble vitamin supports blood clotting and bone metabolism. For gout patients who may have compromised bone health due to chronic inflammation, adequate vitamin K intake supports skeletal integrity. The warning about vitamin K and blood-thinning medications must be noted. Patients taking warfarin or similar anticoagulants need consistent vitamin K intake, as varying amounts can affect medication efficacy. This doesn't mean avoiding spinach, but rather maintaining steady consumption so medication dosing remains appropriate. Patients on these medications should consult healthcare providers about dietary vitamin K. Nitrates in spinach, often viewed negatively, actually provide cardiovascular benefits. The body converts dietary nitrates to nitric oxide, which promotes blood vessel dilation and supports healthy blood pressure. For gout patients with cardiovascular comorbidities, these nitrate-derived benefits support overall health. Oxalate content in spinach raises questions about kidney stone risk. Spinach contains high oxalates, which can contribute to calcium oxalate kidney stones in susceptible individuals. However, most gout patients are not calcium oxalate stone formers, and the risk from spinach appears minimal in the context of adequate hydration and calcium intake. Combining spinach with calcium-rich foods actually reduces oxalate absorption. Cooking spinach reduces its volume dramatically, making it easier to consume larger amounts. 1 pound of fresh spinach wilts to approximately 1 cup when cooked. This concentration makes cooked spinach an efficient nutrient delivery system. However, Some vitamins like folate decrease with cooking, so including both raw and cooked spinach provides optimal nutrition. Raw spinach in salads provides maximum vitamin content and a different texture experience than cooked preparations. The fiber in raw spinach remains intact, providing bulk and satiety. Combining raw spinach with healthy fats like olive oil or avocado enhances absorption of fat-soluble vitamins and carotenoids. Baby spinach offers tender texture and milder flavor than mature spinach, making it appealing to those who find regular spinach too strong. Nutritionally, baby and mature spinach are comparable, so the choice can be based on taste preferences. Variety in vegetables supports dietary adherence by preventing monotony. Frozen spinach provides convenient year-round access with comparable nutrition to fresh. Freezing occurs shortly after harvest, locking in nutrients. Frozen spinach is particularly practical for cooked dishes where texture matters less. It's also economical and reduces food waste since it doesn't spoil quickly. Portion recommendations for spinach suggest moderation rather than avoidance. Consuming 1 to 2 cups of cooked spinach several times per week provides substantial nutritional benefits without excessive plant purine intake. This moderate approach balances obtaining nutrients against theoretical concerns. The overall dietary pattern context matters more than individual foods. Spinach consumed as part of a vegetable-rich, whole food diet contributes to reduced inflammation and better metabolic health. These systemic improvements support gout management more than the plant purines in spinach could theoretically undermine it.